Okay, so now we talk about acne. The medical term for acne is acne vulgaris. We think of it as a disease that affects teenagers. It doesn't just affect teenagers, but it does affect just about all teenagers. They say about 80% of all teenagers develop acne. That's across the world. That's everywhere, whether we're talking black skin in Africa or Asian skin or whatever. Some people just have a few pimples, whereas others can have hundreds of pimples on the face, neck, chest, and back. The problem is that while we think of it as a disease of teenagers, it continues to affect people in later age groups, particularly women in their 20s, 30s, and 40s, and associated with the menstrual cycle. While we need to treat the acute outbreaks, because what you don't want is the outbreaks to develop into acne scars, which is really the dreaded complication of this disease. I think anyone in this room would be hard-pressed to find any disease that causes more psychic trauma, general insecurity, and feelings of inferiority than acne does. So this is how we treat acute acne. Obviously, we use soap and warm water. Benzoyl peroxide is a topical agent. Salicylic acid, they have salicylic acid soap. We can do salicylic acid peels. Then, of course, there's topical antibiotics, and there's topical retinoids like Retin-A. And any of the first four are extremely successful in relieving the problem. If it doesn't relieve the problem, then we get more aggressive. And the bottom line is where you begin to get into problems. Oral antibiotics are fine. We use them all the time for a week or so. But if you have severe acne, you don't want to be on oral antibiotics forever. It can cause side effects. And nothing is more true about side effects than Accutane. Accutane is a systemic retinoid. We take it by mouth. It absolutely dries up sebaceous secretions. It absolutely is helpful in the treatment of this disease. However, it's very controversial, and people talk about whether it may cause psychological disturbances, depression, psychosis, and there's court cases that abound. So if we can avoid long-term antibiotics, long-term Accutane, that's in everyone's best interest. This disease is so prevalent, we spend $5 billion a year on medication to treat it. And so better than long-term antibiotics, better than Accutane, I think, is using laser to treat acne, and laser phototherapy. It uses light and heat energy and is definitely beneficial in relieving acne outbreaks. And here's the kind of, that's a true lunchtime procedure. You come in, you have it done, and then no one knows that you had it done. It takes a few treatments, and it dries up sebaceous secretions, and that will then relieve the acute outbreaks of acne. The problem occurs when you get acne scars. That's a more complicated problem. And there's different types of acne scars. There's ice pick, boxcar, and rolling. In my opinion, each patient requires multiple types of treatment, and the patient and the physician must be willing to use a multimodality approach to address any individual needs. So some of the things that I do include head or facial resurfacing, laser phototherapy using laser and heat energy, fillers to bring out the deep scars, subcision. What that means in English is that you cut below the scar in order to elevate the scar to the surface, and punch excisions where you remove the scar. So every day I go on the websites that are the cosmetic surgery websites, and every day someone's asking, what's the best laser to treat acne scarring? And in my opinion, it's not a question of which laser is best, but really in choosing a physician who's willing to use multiple modalities to achieve the best results. It takes patience. The doctor has to be patient. The patient has to be patient. But there can be a tremendous improvement in this problem. . So this is the kind of results we want to see, and this is deep acne scarring, and what a great improvement can be achieved if the patient is willing to be patient and go through the steps necessary. Again, this lady felt so much better about herself after treatment than before, and that's what makes the whole thing worthwhile as far as what I do. It's very gratifying to see the improvement we can bring to people.